All right. So we'll get the meeting in order here. Roll call. Gloria's not here, so. I am on my mobile device, so I can't tell who's here. Oh, hold on.
That's okay. We'll go with, so Scott Mangan.
Here.
Yep.
Glenn Torrey. He is here.
I see him on here.
Yep. Matt D'Esposito
I'm here.
and Dan Interlandi.
Yeah, I'm here.
Also present, Keith Chapman, Town Manager.
Okay. I sent a link to the AMR supervisor. I'm not sure if he got it or not.
Not that I see.
Okay.
And we're on public participation, and we have no attendees on with us at the moment.
All right. So let's move on. This should be really quick.
Yeah.
So review and approval of the previous minutes. Gloria should have sent them out, I believe, hopefully.
I know I haven't seen them.
Yeah, we've been. All right. Well,
We can
we'll
postpone
table it
that.
for now. Unfortunately, she's not. Yeah, she's not here.
Yeah,
It looks like all she sent out was the agenda.
right.
Okay. All right. That's fine. We'll move on. Town agency reports. So those I did send out. I sent out the AMR reports. We do not yet have reports from Newington, which we discussed at previous meetings. Did the committee have a chance to review the data? It looks like they were actually under the 90% for response times. I don't know if you guys had a chance to look at them.
Yeah, I saw. It looks like October was the high 80s, 89 and 86.1% for priority 1 and priority 2.
Yeah, I mean, it seems to, I mean, it's a thing that's going around, and it's something that's kind of concerning is that maybe Scott can speak to this a little bit. It's just, it's hard to get ambulances on the road, whether you're paid or volunteered or anything else. It's just hard getting EMTs on the road and getting buses on the road. So the response times are suffering all the way around. I don't know if you have something to add to that, Chief.
Yeah, as COVID has taken its toll on the whole healthcare industry, I've been in numerous meetings over the past year at the state level as well as regional. There is a nationwide shortage of EMS professionals. It's really affecting not only the basic life support services, but even the paramedics. And AMR this week, I wish Brandon was here to speak on this, but AMR this week just did a major publicity push to all EMTs, announcing an increase in their wages, substantial increase, hourly increases to try to entice, including for paramedics, a $10,000 sign-on bonus for paramedics. It's affected every agency statewide. I think every municipality and city is seeing the results. We've been fortunate that AMR is so large with many divisions in Connecticut, and then even they can technically pull from Springfield, that we really haven't seen a detriment in availability of ambulances. However, not surprising to see a little bit of an increase in some of the response times. Quite often the ambulances are coming from the north end of Hartford, and we're seeing that, but I can't say that we've seen a detriment in patient care. because as we all know, response times are not a indicator nationwide. Response times have fallen off the map for an indicator as to a service's goals, and the real outcomes come down to patient care and outcomes of the hospital releases. So I don't see that there's going to be much of a increase. Everybody's struggling with manpower right now. So that's where EMS sits.
Frankly, I'm kind of impressed that they are even maintaining high.
Speaking of go ahead.
I was just saying, frankly, I'm impressed that they're even meeting the high 80% mark at this point. I think our community has been fairly lucky, and some of the surrounding communities have been seeing bigger increases.
Yeah. Yeah, I mean, like I was saying, they have, the National Registry has plans in place to kind of expedite EMT classes where they just take the written test and not worry about the practicals. But then you have to worry about the quality of the team. So that's a give and take with that. So just that the committee is aware that sometimes response times are not going to be the best because of the shortage. Any other questions with the reports? Okay, we'll move on, please. All right, so old business, at Newington EMS, we still haven't obviously get reports from Newington. We're still waiting on the CAD system and stuff from the PD, I believe, Scott.
Well, again, I think it's unfair to blame the CAD system. The programs that our dispatchers are using are very capable. Data is out there. Towns around us, cities around us have the data. This has been an ongoing problem for years. Chris Chaplin's addressed it numerous times too, is that there is a problem with sharing data through the Newington Interchange. And I believe even from EMD portion, there's been strides made. The senior dispatcher, Russ, actually many meetings ago, that Newington's CAD system has the capabilities. However, due to IT requirements and things like that, the data cannot be shared. And the same thing holds true with our reports. What we end up getting from the police department is a PDF copy every Monday morning, 100 pages, and the data is just not transferable. What we need is the true interchange, but that would come at the same time that the AMR CAD bridge would be in place, and the same time that we would actually be able to get MDD terminal access, so that when our calls, crews jump into the ambulances, much like the fire department has, they would actually have online access to the
burgers. I'd like to order some
call data
a
and maps.
blue and gold double on a bun. You can have a Rice Krispie treat.
Okay. So that was pretty much what I had. I don't have any questions on that.
Just as a note, Brandon Bartell joined us at 6:16.
Brandon, welcome.
Yes, welcome.
And I also have a phone number on attendees. I'm not sure if it's a member. If they are, if they could hit *9 to notice that they are. No. Okay, you just be a public attendee interested.
Okay. Thanks for the info, Scott. I caught most of that. I actually got disconnected for a couple of minutes. I got the gist of it.
I mean, we're still kind of in the responses about Newington and AMR. So I don't know if Brandon, I know one of the questions that was brought up was concerns over staffing, the nationwide manpower EMS struggle that we're all handling. And I did mention that I wish Brandon had some input. So if Brandon can join us, maybe just do a little brief. I gave him the rundown about nationwide where the problems are recently.
Yeah, sure. Good evening, everyone. I apologize. I didn't have the Zoom link in my email. I think everyone is aware of the struggle and all different types of industries, healthcare, especially EMS. So certainly, statewide, there's a shortage of EMS providers. Pretty much every EMS agency, fire department, et cetera, is looking for staff. The pandemic had certainly escalated or intensified some of the probably lingering concerns with the EMS industry in general. I know from my perspective, at the start of the pandemic, we've had some employees, that were close to retirement that decided to retire early because they were concerned about, the COVID virus and how that could affect them and their families. And then we've seen kind of a decrease of individuals, earning their initial certifications. We saw, paramedic programs that were struggling to, operate during the pandemic. There was a reduction in clinical sites available for students to be able to participate. So we're kind of feeling that backlog of new individuals kind of entering the profession. So one of the things that we have done last year, and we're continuing to do at AMR, is we've run these On Way to Learn EMT academies, where we essentially hire individuals that have an interest in becoming EMTs, and we've paid them an hourly wage while they're in our EMT academy, and we cover all of the costs of the EMT program, testing, et cetera. And then upon successful completion of the program, and when they earn their certification, they're promoted to EMTs and they work out in the field. So we did one of those last year. We actually will be announcing another cohort of that class starting in February. So we will be opening up that application period very soon. And just locally for us, one of the mitigation tactics that we've been working on. So we've been hiring pretty much ongoing since the summer, EMTs and some paramedics. And we just recently did a market adjustment on wages for EMTs and paramedics, and did a little bit of advertising on that to not only take care of our employees, but to help with retention and to recruit some other individuals. But that is kind of what we're facing. And then on top of it, we have call volume that it seems to be increasing, and the delays. So we typically see the other areas of the healthcare system that are also short staffed and with their backs up against the wall. We see delays, for example, being able to turn over patient care in a hospital because there's a lack of beds available in the ER, or there's not a nurse to give report to, et cetera, which not only creates a longer time for that ambulance to, finish up their duties and return into service, but that also stresses the ambulances in the system and in the region, because during that time, there's other calls that come in. So that's kind of like a brief overview of the current situation. I think there's a lot of work to do, with getting providers trained and certified in the pool to choose from, because the applicant pools are small. So Scott, is there anything I missed or you want to add there, or?
No, I think you really summed it up, and I think strengthened what I reported. And the one thing I didn't have, but there was definitely, and I know that the media is reporting about the COVID, strengthening on COVID. And while I think the COVID has technically increased when you look at the number of people that get tested versus, but the amount of people getting tested is way down from last year. However, the hospitals are overrun with just rooms. It's very common now at a couple of local city hospitals. You can figure out who they are, but to be fair to them, a couple of city hospitals, that it's very common now for patients to get in the ER and be there for 2 to 3 days before a room opens up where they can move them out of the ED. We go into a hospital, AMR sees this every day too, and they've literally stacked stretchers 2 deep for every room. The last week, we had crews, average wait time for the crew to be able to transfer the patient care to the hospitals 20 to 45 minutes. So that's 20 to 45 minutes added to every call that, and quite often, even Newington EMS, we're responding from Hartford Hospital back to calls in Newington. So again, as EMS committee pointed out before Brandon joined us, we've been fortunate that we really, from the time of 911 dispatch to arrival of patient care by an EMS agency, we haven't seen a real increase in Newington, but that's not indicative of what's happening in the industry, because the industry is being forced with waiting at the hospital longer to do first patient transfers. And that's just stretching an already bad situation with not having EMTs coming out of the classes for the last 2 years. Newington EMS is seeing the normal attrition rate of EMS. I mean, we did have a few people, as Brandon reported in his service, retired that probably would have stuck with us, but we didn't have the influx, the normal influx of turnover. There was no influx for the last 18 months of classes. So we're all seeing that, and then that pool's out there pretty dwindling down. So I think as community, Newington's done very well. Our commercial partners done very well backing us up. Matt saw that, reported that, and but it's just a matter of before the system breaks to the point that we're here talking about the longer response times next month or the next meeting. I think it's 3 months from now. But we're doing well. We're holding our own. I can't say we're doing well. We're holding on to it and giving the town the care it needs.
Excellent. Yeah, and that's a testament to both AMR and Newington Ambulance. So thank you both. Any other old business? I think we're on to new business, I believe. So actually, I think this is the old one. Unless not it transferred over. The only thing I have for new business is the updated the meeting schedule and the public complaint. So unfortunately, I've been having some medical issues for the last few weeks. So I will have the schedule for next year, hopefully available to the committee within a week or so. The second thing is I did get a public complaint on 11/15/21 regarding a call during the day with AMR. I talked to Brandon about it, and he looked into it. Brandon, if you have any comments, I know we talked about it and you took care of it internally, but
yeah, so we just received the complaint about a specific call, and so we reached out to that complainant and internal investigation with our folks, but all is that's been closed out and rectified.
Okay, that's fine. I guess it was a matter of public record, so I just wanted to address it. Thank you for getting back to me on that. So now we're down to information sharing. Anything from members of the committee?
So just Brandon, again, I'll just say that, we are starting to see a little bit of relief, with our ongoing recruitment campaigns, and finding some EMTs to kind of put through our orientation. So, over the summer months, in September, October-ish, we had some folks that were, out sick and, your normal attendance, book offs, et cetera. But our ongoing recruitment that we started over the summer that's continuing monthly has started to pay off. So we're seeing that improvement with staffing going into the new year. So that's been beneficial. And we're hoping that we could keep that momentum going so that we're in a good place with staffing. But just to kind of circle back on what Scott pointed out, even if staffing is 100%, the healthcare system as a whole is really, really stretched thin, and there are a lot of external factors that can impede, readiness of ambulances, et cetera, that, we're kind of all working with collaboratively with healthcare systems, et cetera, to kind of improve processes and flow. But, all facets of the healthcare system is short, from providers to nurses to techs to registration. So we just see that on a daily basis.
Yeah, thank you. I did receive one of those flyers in the mail.
Dan, can you hear me?
Yeah.
I just have a question. More of I'll call it a soapbox issue.
Sure.
Consistently throughout the day, whether it's AMR or NEMS, when they get sent on an EDP call, they're sending them lights and sirens on an emergency to stage. It doesn't make sense if you're sending them lights and sirens to go and park, because that's kind of dangerous for the crews, the equipment, the public. It just doesn't seem to make sense from my point of view. And I've been on the dispatch side, I've been on the response side. It seems like an unnecessary thing. I understand if it's an emergent situation and there's something actively happening and they need them right away. But if they're going there to stage, it seems to be, counterproductive.
Yeah. I don't know if it's a EMD thing, a dispatch thing. I'm not privy to that. I'm obviously not at dispatch, so I don't know if anybody on the committee or anybody else has any comments on that.
I think that's something we could follow up with Dispatcher Garuti and get a feeling on what their protocols are and what's driving that response.
Yeah, just that, I would hate to see a member of the public, or God forbid it's a crew or somebody. Recently, if from AMR's perspective, they were responding. I don't know what the call was, but they had an interaction between them and a Hartford fire vehicle, which didn't turn out as well as it should have. It's just, it seems to be getting away more and more from lights and sirens response, and my mind is, if you're going to stage, Newington's almost 7 miles across, almost 14 miles wide. You can still get there in a reasonable amount of time.
Maybe we can invite Dispatcher Garuti during our next meeting.
Yeah, Glenn, Brandon here, I agree with you. We do see that a lot in some of the other areas that we cover. We could certainly work with Dispatcher Garuti and, as Matt said, and just look at some of those call types, because dispatch non-emergency times are where they may be emergent responses, but we could dig into those.
Because a while back we had the situation up where it was like, I think it was off of Kitts Lane. It happened around a truck's crew change. They'd been there for a while. I do remember that call. They were sent on an emergency response to stage.
Okay.
Yeah, we can get maybe get Dispatcher Garuti to join us next meeting, and we can see what the protocol is for this sort of thing.
Yeah, no, not a problem.
Anybody else? I think we're up to 9.0 public participation. I see a hand up somewhere.
That's correct. I do have the attendees hand up. I'm going to unmute them now. And if you're on your phone, *6 will unmute. You should be able to state your name and address for the record.
There. My name is Kevin Bennell, and I just had some membership questions. So I think I wasn't supposed to talk, but yeah, I just had some membership questions. I know it might be the wrong place to be on. That was all.
The membership questions in regards to what? Would you like
Joining on Newington EMS if we wanted to be a fireman too. That was all. If they can both join. That was all. But yeah, be safe out there.
All right. Thank you. If you are interested, training at newingtonems.com, and they can get you some information for what you need.
Okay, thank you. I just wanted to listen in to see what it's like. But thank you again.
Sure.
And that's all we have for public.
All right.
And that brings us to adjournment.
This is adjourned. So do I have a motion?
Motion to adjourn?
All right. Second.
Second.
All right. Meeting's adjourned, and like I said, hopefully within a couple of weeks, assuming that I'm healthy, I will get a schedule out for 2022. Thank you, everybody, and enjoy your holiday, Christmas, and such.
Yeah.